Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. Sorry about the musical technical difficulties. It's been one of those weeks in this TV studio that I've built. All kinds of technical issues, mic and all sorts of stuff. So anyway, it is that time, 12 p.m. Eastern, Friday, every Friday just about, for that I answer your questions, whether they're surgery, injury, rehab, recovery. This is the one place that I do that. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help people, active people, athletes like you, feel, look, and perform your best regardless of age or injury. Please note, as always, I say this every week and it's true every week, I am not giving you medical advice when I answer these questions. My answers are for educational and informational purposes only. I haven't seen you, examined you, looked at x-rays, MRIs, any of that kind of thing, so I can't give you specific medical advice. The purpose would be to take this to your doctor, to your surgeon, whoever, and say, what about this? Or maybe just to help you understand what he or she said a little bit better. And as always, I'll stay as long as there's questions. Sometimes there's just one or two. Sometimes there are 30 or more. So feel free to ask your questions, but if we don't have any, then I will take off. All right, Kunwar, femur surgery 7 months ago, ORIF, walking without support, nothing. Doctor told me the bone has healed. Sees a gap between the bone. I'm not sure what part of that was the question. It's so long, I'm not going to make everybody read it. But if there's a gap in the bone, assuming, again, I can't see it, that would be a better question for that surgeon. But that typically means that it hasn't healed. As far as taking implants out, we don't usually do that unless there's a need for it for some reason, and that's why, at least for femurs, I don't do that surgery anymore, but used to do the intramedullary rods down the center of the bone. But some fractures, you can't always do that. But even then, you rarely needed to take the implant out, the plate and screws, so I'm not 100% sure there. If it hasn't healed, then you'd have to you talk to the surgeon about what it takes to get it to heal. If it truly is that far out, a lot of times that is not something surgical that, or not something that, a bone stimulator or something like that. It typically needs surgery. All right. It looks like Kunmar's, those are his only questions and nobody else has any. So I want to say, address one thing that has come up a lot in people that have reached out to me to see me as patients. And if you want information on how to do that, the information is in the description below. Fill out that link. That takes you to my contact form. Fill out your name, phone number, email, and then type the word interested. We're looking for patients with knee, shoulder, or hip pain, low back pain, that want to get significantly better in 30 days without surgery or cortisone shots. So you can certainly do that. But one of the things that people ask when they reach out is, what about BPC? What about penicillin? What about exosomes? Or what about PRP? And how much does that cost? One of the things that I'm a true believer in, one, you just have to realize a lot of those are either experimental or used off-label, just so you know that. Number two, in my experience, any one treatment for something like knee arthritis isn't the magical cure. I mean, it can certainly be better. We don't have a lot of data on some of those things to show that, hey, it definitely helps it heal and look like it was never injured before. They do seem to be very helpful depending on what the problem and which of those you're talking about for pain. And they may have a significant effect on reversing the disease process. But I'll say that I typically don't do any one thing. I direct a treatment specific to the patients and their injury and specifics about them and a lot of various other things, and then approach the problem from different angles, whether that's stopping the damage, whether that's rebuilding whatever that tissue is, muscle, tendon, ligament, cartilage, bone, or optimizing the structures around it, or more commonly, all of those. And so somebody asks, all right, I want to come for penicillin and just penicillin, what does it cost? I almost never do that. Or whatever the treatment is. I am very pleased with the progress of the patients I've had, and about a third travel in to see me, and I think they would tell you the same thing. But having said that, I don't know that I have any of them that are just on one particular treatment for what that's worth. All right. Yeah, so Kunwar, I can't do that. It's illegal in the United States to give medical advice, so you can't send me x-rays and I could give you advice on that. So you'll need to do that with a doctor wherever you're located. That's a kind of a message. Not many people ask me that anymore, but you cannot do that in the United States. That'd be practicing medicine, that'd be treating, and you can only do that in states or countries where you have a medical license, and at least that's how it works in the United States, so I can't do that. All right, it is Easter weekend, and I'm going to let you all get to your Easter weekend. I hope it's amazing for those of you that celebrate Easter. Regardless, hope you have an amazing weekend, and I will see you right back here next Friday for Ask Dr. Geier Live. Have a fantastic rest of your